All right. Good evening, everybody. Good evening. It has been a little bit of a moment since I've been on. I've been just trying to figure some things out, but I think I got some exciting stuff. So, without further ado, I saw an interesting topic today that I had been thinking about, over the past 2 months or so. And I said this would be an interesting topic to talk about. So tonight we're going to talk about the immediate closing or the effects of the immediate closing of a lot of our federal agencies and programs and what's going to happen next. So I don't know if you guys had seen. Well, let me start off by saying this. Um, so I have many friends that are federal workers or who were federal workers who were laid off of their jobs from many different agencies. Over my time in working in the federal service, I started to understand how important all of the agencies that we have, how important they are because they all have a specific job. They all have a task to do. And so I worked with health. So over my time there, I got to learn so much about the nation's health, the crises that we face, how they can be resolved. I've watched as our agency quickly kind of stamped out something that was coming. So it just really taught me a lot. And I said, each agency has a job to do. And when we started seeing the cutting of the agencies, the programs, the workers, it was alarming to me because then I said, who is going to do the work? And so I know I talked to a lot of my coworkers during that time, and I know they probably got tired of me saying, who's going to do the work? Who's doing the work? Because I got to learn that the work was so important. So over this weekend, I saw a story about a school in Milwaukee that is having a lead crisis, right? So for those of us who are, I think, like in our 40s or so, we can remember when there was a big thing about lead paint in schools and children becoming ill. This was back in the day. I can't even pinpoint like what year or time that was, but I remember vividly when seeing that on television, how they were talking about, oh, the lead paint in schools is going to make children sick. And some research I saw, it said one of the draws for um, children when it comes to lead paint is it actually has a sweet taste to it, which I was like, who is tasting it? But when you think about younger children who touch everything and then put their hands in their mouth, they taste everything. And if it tastes like remotely sugary or sweet, they'll do it over and over again. Like I mean, we see children put their hands in their mouth after crawling on the floor. They have no idea what they're doing, or the danger or hazard to doing that. So imagine if they're touching paint, on the walls or what have you, and the lead in the paint is getting on their hands, and then, as they taste it, it is a sweet taste, and they do it repeatedly, even inadvertently if they're doing it, the danger that it can cause for them. One of the things that I did see, a little piece of research, was tying reduction in IQ and attention and behavior to the ingestion of lead, like in paint. And so I thought that was really interesting. I said, you know what? That is, I'm sure, why it was such a large cause for alarm, years ago when they identified that the schools had lead paint in them and they were required to kind of strip them down and repaint and all that kind of stuff with paint that did not have lead in it. So, like I said, the story that I saw this weekend was a school in Milwaukee where a young boy had gotten sick, and when he was tested, he found out that he had a high level of lead um, toxicity in his system. And so what they did, the parents thought, is it something at home? They tried to, remove different things from the house, and they realized that the levels are not going down. So it's not within the home, there's somewhere else. And so they thought immediately the school was tested. Come to find out that there is lead paint there. And then come to find out further that there are actually 3 schools in Milwaukee that are not very far apart that also have this paint, and that can be possibly harmful to the children. So, with all that said and done, I want to share a little piece of the video that I saw just so that you can get an idea of what we are facing.
We begin Saturday at 5 with the top story we've been following for weeks, the Milwaukee Public Schools lead crisis. The CDC now says it cannot help the city's health department manage the lead hazards. Officials blaming the Trump administration's mass federal firings. 12 News' Emily Polfall joining us live at Starnes Early Childhood School. Emily, that is one of 3 MPS schools closed right now due to lead.
Right. The Milwaukee Health Department requested aid from the Centers for Disease Control and Prevention to help test and clean up schools like Starnes. 12 News obtained an email from the CDC to the City of Milwaukee Health Department dated April 3rd. One CDC official writing, "We sincerely regret to inform you that due to the complete loss of our lead program, we will be unable to support you with the EPA aid request." Milwaukee health officials say lead issues affected 7 schools this semester. At least 4 students have tested positive for lead poisoning in recent months. The health department now plans to test all MPS schools for lead, a huge undertaking as a vast majority of its buildings were built before lead paint was banned. The Cannon Brown Homeless Sanctuary is working with the health department to test students for free, and they say losing help from the federal government poses real challenges here in Milwaukee.
And hopefully that the CDC would see the importance of it, and that they would actually know how important it is for them to actually try to fund it. The health department, you can't do it on their own. And that's the thing. When we live in a village, it's basically for everyone. We all have to come together.
And Emily.
So, as I watched that little clip, I said, even in listening to the young lady that we just saw speak, she was saying that, they're looking at the CDC, right? But what actually happened is the division that would actually provide the aid to the state for the schools to do this work has been eliminated within the CDC, right? So this is like one of the first things where we're actually seeing that due to the elimination of a program, a federal program and a federal agency or portion of an agency, we're now starting to see the negative effect of that. With this particular case, I found it interesting because with some of the other agencies, what has happened as people were laid off and sections of agencies were closed, they had to roll people back and bring them back in the office. I had actually a friend who told me that he worked for USAID. They came in, he was with that first group that was asked to leave. And, they packed up and left. And he said, like a week or so later, week and a half later, they called him back. But they called him back because all of the people that they had laid off, they needed people to process them out, to do their offboarding. So they had to call people back, right? And so with this situation in Milwaukee, I think something similar will probably happen. They will have to bring people back to open up that division to be able to assist, because it is the federal government that provides that aid to them so that they can get these things done. The other thing that came to my mind was, like I said, I was working with Health and Human Services, and over the past year, there was a huge uptake within the nation, within the country, in regards to syphilis. And we watched as syphilis started to spread. It wasn't talked about a huge amount, but there was a growing spread. And in our agency, there was a task force that was put together, and they met regularly. At one time, they were meeting every day for like 2 to 3 hours, trying to come up with ways, how can we eradicate this? How can we get it under control and ultimately stamp it out? They were able to do that. It took several months, but now we actually see that um, we're right at kind of like at the beginning of the measles outbreak. We saw how it started in Texas. It was kind of contained to that one area. Then it started to slowly spread, and now we're actually seeing more of an outbreak. And even here in Maryland, where I am, we have cases up here, right? And so this is something that we thought we would not have to deal with because most people got their vaccinations when they were supposed to. But we also, over the past few years, have experienced this uptake of parents that are not wanting to get their children vaccinated. And far be it from me to tell you what to do with your children. I can't promote one thing over the other because I am not a health professional. I'm not a medical health professional, I should say. And so I don't want to venture in to say what you should do. I know if it were me, I would lean more to getting the vaccination because I know that having been vaccinated as a child myself, there have been many things that I have avoided. So I would want the same thing for my children. But that is a personal decision, and each parent has to make that for themselves. But as we see growing measles issue, have, I believe, seen 1 or 2 deaths, if I'm not mistaken, which is very surprising, right? So those would be more extreme cases. But same way we saw with COVID, how we knew COVID to be a common virus, but we had never experienced it or the mutation of it to where it had been deadly, right? So the same thing, we don't want to see that with the measles, but the point of it is that within the Department of Health and Human Services, one of the main factions that helped to stamp out the syphilis crisis that we were experiencing was the Office of Infectious Disease, which fell under the Assistant Secretary for Health. Unfortunately, the Office of Infectious Disease and HIV/AIDS policy has been eliminated. That is the office that took care of, or they provided information for all of the diseases that were out there. So we did, or I'll say we did Mpox, which was like the monkeypox crisis that we were in. We did HIV/AIDS. We did all types of vaccinations, antimicrobial resistant vaccines, and diseases we covered. So it was just a lot of things that fell within that office. And unfortunately, now that that office is no longer there, I think that is going to be the problem. So my question is, what's next? I think we all have to kind of figure out, what are we going to do? What's the best next step for all of us to keep ourselves and our families safe when it comes to infectious disease? And, we don't want to always think about infectious disease as just things that are deadly, because there are things that are not, but they are not things that we definitely want to be spreading and have run rampant through our nation. So I think we have to think smart. It's quite unfortunate that our administration now has rapidly and blanketly closed a lot of the programs and divisions and agencies that will take care of a lot of things that we need without doing any type of research or evaluation or analysis of what could we possibly scale back without causing major harm to our nation. But we are here now, and I think at this point, it is up to the people to speak on certain things. So like the people in Milwaukee, I would hope that they would challenge our federal government to reopen that division so that they can get the aid that they need so that the children won't continue to get ill. Because, like they said, there were 7 schools total that were tested. And I think I forget the number of students that they said tested positive, but any student that tests positive for lead poisoning or toxicity is too many. Any one is too many. So I think that's something that has to be addressed. And like I said, I hope that they put the pressure on the federal government to open that division because it is going to be needed. I hope that the pressure is on for the Office of Infectious Disease to open back up. Yes, there are other agencies like CDC that has their own office. They don't all do the same thing. And that's the most important thing to remember. Offices don't do the same thing. They may have the same type of division, but they don't all do the same thing. So you can't just say, well, we'll close this and send it over here, because they don't do that. And when you close something, you get rid of the employees and you transfer the work to someone else who's not used to the work or who knows nothing about the work. What are they supposed to do with the work? So like I said back in the beginning, my question always was, who is doing the work? So with that being said, I'm going to close out. I'm going to leave you to think about that. I'll keep you updated on anything else that I find out about that story. And like I said, I'm hoping that Milwaukee, the government of Milwaukee will put the pressure on the federal government to try to get the aid that they need to be able to rectify this problem. So this has been a segment or an episode of I'm Just Saying with Dr. B. Like I said, I always have plenty to say. I just have to have the time to say it. But thank you for joining me, and I look forward to talking to you again very soon. Have a great evening.